Hello, this is Chris Jacks. I'm the unit nurse educator here at Emory St. Joseph's in the emergency department, and I'm going to show how to set up the EVD, or the external ventricular drainage device, for a ventriculostomy. Okay, if you want, the equipment that you need is on the ventriculostomy cart from the clean utility. You can bring it all in here or gather the supplies. You definitely will need the ventriculostomy drainage box. You'll need the level. You'll need a set of sterile gloves, a 20 cc saline vial, and a sterile syringe. Do not get the syringes for flushes. They are not sterile. Okay, so the first thing you want to do is open the drainage. It comes in this big box. So you also, before you start doing this, you're going to put on exam gloves, clean or wash your hands, sanitize your hands, put on exam gloves. Then you're going to open this up, and this is going to be a sterile. Leave it in the package, because this is a sterile procedure. When you open it up, I'm going to leave it sterilely. Then what I'm going to do is I'm going to drop a sterile syringe on the field. There we go. And then I'm going to switch to sterile gloves. This is where you're going to need someone to help you do the saline, drop the saline flush real quickly. I'll get my sterile gloves on. Then I'm going to have someone help me draw up the saline. Okay. And you need about a full 10 cc's. Okay. All right. Again, like I say, you're leaving all this sterile on the sterile package. This is a sterile procedure. Okay. You have to remove this sleeve carefully. Let's go this way. Okay, the next step is we're going to prime the tubing. We prime it kind of backwards from the way that we do most other tubings. So you're going to start, find the patient end, which is the shortest end from where the stopcock is. I'm going to insert this syringe with the needle still on it into this adapter. I'm going to turn the stopcock to where it's off to the drain side, which is going to be this way. So this is the rest of the drain. This is the patient end. I'm then going to flush the patient end. Have to remove this little cap. Again, keep that sterile. Flush it till it comes out there. Okay. Then I'm going to replace the cap, if I can find it. Then I'm going to take, keeping the syringe in the male adapter, I'm going to turn the stopcock off to the patient side so I can flush it this way, but then I've got to find the stopcock at the drain. Should have a red cap on it. I'm going to turn it off towards that red cap. Off towards the rest of the drain, and remove the red cap and flush it so it comes out there at that drain. So right there it comes out. I'm then going to take the red cap, put it back on. I'm going to turn the stopcock off to that red cap, and now I'm flushing it into the drip chamber. All you're doing is getting all the air out. Once you see it coming into the drip chamber, then you're finished. You can remove your syringe. You can then keep this off to the patient. Next, you're going to hang this up and hang the whole drainage on an IV pole, like this. Then you're going to hand this in to the surgeon who's put the ventriculostomy catheter in. You want to make sure that your patient is at a 45-degree angle. The physician is then going to connect the drainage tubing to the ventriculostomy catheter. Okay, once they get it connected, the next thing you're going to do is level. Sorry. You're going to level this stopcock where the next thing you're going to do is clamp this so it won't drain too far. You don't want drain in here just yet. The fluid's drain here. So the physician is going to tell you where he wants this pressure level at on this scale, either millimeters of mercury or centimeters of water. Typically centimeters of water, usually 15 is the standard. So you're going to loosen this screw, bring this pressure level arrow down to 15, screw it back tight so it holds in place. You're then going to level this 0 mark at this stopcock. And this is where the transducer will go when they go upstairs to ICU to be monitored for ICP. You're going to take your level. You're going to start at the patient's tragus of their ear. So let's say it's right here. I need to put the other end at this stopcock. So I'm going to lower it like that. And then once I get it level, that's where I need to do or need to keep it at. In the ER, we don't have the transducer cable that fits this, so you will just be able to level it. We won't be able to zero it. If this chamber fills up, the first thing you're going to do is turn this stopcock off to the patient this way, so it won't, this vacuum won't suck fluid up in it or herniate the patient, which you don't want to do. After you turn the stopcock off to the patient, then you're going to unclamp these 2 clamps. You're then going to allow the drainage here, after you've documented it, drain into the bag. Then once you're done, you're going to clamp these clamps back on. And then turn the stopcock back off to that port and allow it to drain. Okay, when you transport this patient, all you have to do is take it off of the IV pole, put it next to their head, and take the patient up. You can't monitor anything. You just don't want it to be below their head, so it pulls too much or pulls fluid suddenly, and transport them upstairs, and they will level it and zero it when they get up there. Anytime you move the patient, if you turn them from side to side, have to clean them up or whatever, you need to re-level this.